To those just joining, welcome. It just takes a little bit of time to let everybody into the meeting. I think we are recording the meeting, so I think the recording has just started. So we'll kick off. Unfortunately, we can't mute that little beep, which is whenever somebody wants to join the meeting. So apologies for that. So welcome everyone to this webinar. This is the second webinar we've delivered today, and this is really just to update you on the work we did on the advanced practice review throughout phase one, and to talk about the recommendations that were agreed by our council for us to proceed to phase two and what comes next. My name's Paula McLaren. I'm the Senior Advisor for Advanced Practice. So I have been working with colleagues from across the 4 countries, our nursing and midwifery advisors, as well as our internal NMC team and colleagues, so our standard specialist team. So it's really great. There's been a lot of interest in this work, and it's great to see so many of you here this afternoon. I'll let Aditi introduce herself. We'll be leading the discussion this afternoon. So our plan is to present the work that we've done, talk about next steps, but then give you an opportunity to ask us questions. Actually, you introduce yourself, Aditi, and then I'll carry on with the rest. Sorry.
Sure. Thanks, Paula. Hello and welcome, everyone. My name is Aditi Chaudhary Gandhi, and I'm Head of Standards at the Nursing and Midwifery Council. Thank you very much for all your time today on a Monday afternoon. Very lovely to see so many of you. What I would just want to say is that a lot of what we're going through, what we'll be covering today, is kind of bringing you on the journey of the past 1 year or so in terms of what we've covered as part of phase one. So some of you may have been part of our engagement and indeed helped us shape some of our thinking. So it might seem like a repetition. We are starting on sort of from the beginning, so that those colleagues who haven't been part of the journey can understand how we got to our position. So that's mainly what's going to be covered, and then a little bit on next steps in terms of what phase two looks like for this particular project. Another sort of housekeeping point is that we don't really have the raise your hand feature at this point for this particular webinar, given the large number of people joining in today. So over to Paula to kick us off.
Great, thanks, Aditi. Yeah, Aditi mentioned the Q&A chat box. So if you have got questions, please do put the questions in there. We've got colleagues who are monitoring that and who will ask us the questions or share your questions at the end. If you have any technical problems or any other challenges, you can email us at Advanced Practice, and that inbox is being monitored this afternoon. Just to let you know, you will all automatically be muted. So the only way you can talk to us is either through the email address or the Q&A function, and that's in order for us to be able to manage the conversation with so many colleagues. We'll try and answer as many questions as we can, but due to the number of people attending, it may be that we can't get to them all. And if we can't, our plan is to put a bit of a Q&A and answer those questions and share that on our website. So we will do that. If you've got colleagues who haven't been able to register for the webinar, we are recording it and it will be put on our website towards the end of the week. If you want to access the slides, they'll be there as well. And just to say that colleagues can switch on live captions for accessibility. So Aditi mentioned the journey we've been on. Before I start with this slide, just to say this is just the beginning of phase two. So we're just at the beginning of starting to think about kind of what comes next. All of this work takes time. You know, Aditi talked about the kind of year of developing evidence, and probably 18 months actually to get us to the point that we're at now. And actually the work that we've got yet to come will take time, so it's not going to happen overnight. We like to start with a bit of a kind of regulation 101 about us as a professional regulator. Most of you will know that we were, as the NMC, established under the Nursing and Midwifery Order, or the order as it's known to us who work at the NMC, in April 2001. And the order sets out our primary function and role, which is ultimately protection of the public. And everything that we do is with that ultimate goal. So it also sets out our organizational structure, the functions and activities that we take out, our obligations and rights, and our powers, and that of you as registrants as well. So again, the majority of people will know that we set standards of education and training, performance and conduct, and we investigate where standards are at risk of or not being met. So that relates to education standards, but also relates to individuals as well. So we ensure that nurses, midwives and nursing associates continue to meet our standards throughout their careers to provide high quality, safe, kind and effective care to members of the public and patients. So we have a register of just over 800,000 professionals. It's growing day by day. That makes us the largest health and care professional regulator in the UK, if not in the world. We quality assure education and training programs, and those of you who are from the higher education sector will know all about that. But that's to ensure that, as I said, that professionals who've been through our training programs are able to provide high quality care. So we have transparent processes for investigating where individuals and learning environments do not or are at risk of falling short of our education standards. Some of the things that we don't do and people often get confused about is that we don't regulate health and care settings. So that is the job of the system regulator, not the professional regulator. However, we do work together. We don't regulate support workers, so healthcare support workers are not on our professional register. We don't represent or campaign on behalf of our registrants, and we don't get involved in setting safe staffing levels. So our regulatory role comes under these three umbrellas, if you like. We regulate, we support, and we influence. So we regulate through setting standards, as I've said, quality assuring education programs, and we maintain a register and we investigate concerns where there are concerns reported to us. In the support space, we develop resources and guidance in order to help registrants and stakeholders ensure that our professionals are able to meet our standards and address any challenges where we need to. We also, in the influence space, share intelligence to support wider workforce development and wider kind of sector-wide decision making as well. So I am going to hand over to Aditi just to go through a bit of the background and the context and the journey that we've been on. Thanks, Aditi.
Thank you, Paula. So by way of background, some of you will be aware we embarked on an ambitious education change program that was completed in July of 2022 with the publication of our new post-registration standards. And as part of that review, we recognize that those standards are going to be a bridge to the work that we do on advanced practice. And indeed, we have done that. So as part of our 2020-25 strategy, corporate strategy, we committed to undertaking a review of advanced practice and to try and understand if we need to be regulating or providing additional regulation to advanced practitioners or not. So in 22-23, as part of our corporate plan, we embarked on a discovery phase or evidence gathering for this particular piece of work, this particular review of advanced practice. And we commissioned the Nuffield Trust to conduct that initial evidence gathering. We published that report in May 2023, and that has really given us further food for thought, I should say, because it's given us areas where we wanted to develop further and helped us to identify what we call key lines of inquiry.
Sorry, Aditi, can I just say, somebody's just put that their slides aren't changing.
Yes. So we've had that problem in the afternoon as well. I think it's to do with the large number of people joining this particular meeting. Um, so what I would suggest is everyone can see all of the slides, but if you sync to presenter, there's a little box underneath in red that says sync to presenter. So you should be able to see the slide that I'm referring to as I speak. But yes, give it a little bit of time. It can get clunky with the large number of people joining into the call today. Also, as Paula said, this is going to go on the website should you have any issues with being able to see any of the slides. So going back to where I was in terms of the context, some of you, or rather most of you on this call will be aware that all nurses, midwives, and nursing associates practicing in the UK are very much required to be on our register, and this includes those who work in advanced practice roles as well. So the question that we are trying to answer in this particular review is whether we need that additional layer of regulation for those individuals who work as advanced practitioners. So our register currently does not have any mechanism for identifying who works in advanced practice roles, and neither do we set any kind of educational requirements in this space. The other thing to note is there's a huge variation in terms of how advanced practice is defined, what the employment context is. So the job roles and the job titles are also quite varied, and that's across the 4 countries of UK. It's also across nursing and midwifery. So all that being considered, that is the context in which this review has taken place. Also bearing in mind that the 4 country workforce plans are different, educational commissioning models are also slightly different, but there is a growing number of advanced practice workforce. So the time is right for us to undertake this review. And what we have done really is started with an evidence gathering. Now, part of the evidence that Nuffield Trust presented us with as part of their research was the fact that there is a lot of inconsistency. So there's plenty of variability in terms of employer requirements and approaches, the job titles that they have, the job requirements that they set. And this in part is also because there's huge variation in educational preparation and the pathways for individuals to become advanced practitioners. Now, what that translates into, of course, is a lack of clarity in terms of scope of practice. So who is actually doing what bits of advanced practice roles? Because we know that advanced practice is all about a level of practice, and it sits across professions. So across nursing, midwifery, and the allied health professions, you will have advanced practitioners. So often there is a confusion in terms of who does what. And that, of course, is the main reason why there's a risk for public protection, because members of the public have limited or no understanding in terms of who is actually providing the care, what is their professional background, and whether or not they are advanced practitioners in title or in competency, and what they can realistically expect of those individuals who are practicing in those roles. So this huge variation, of course, has therefore related risks that are associated with it due to the nature of the practice as well. So we know that advanced practice is a high level of practice. It does involve quite an additional layer of responsibility. So whether that's activities like diagnosis or interventions, even having the decision making in terms of whether people should be going to the hospital or whether they are discharged from a hospital, sometimes can be taken by advanced practitioners. So we know that there's that additional risk, and yet there isn't enough clarity when it comes to advanced practice. So these kind of key findings were really the driving force behind the discovery phase and us identifying how we need to take this work forward as part of phase 1. So what we identified were 9 key lines of inquiry to guide this process. And what we did with the 9 key lines of inquiry really is to break down this really complex topic of advanced practice into manageable areas for us to consider this really complex area fully and identify regulatory options that we can take to council in order to consider the regulation or the additional regulation of advanced practice. And each of these 9 key lines of inquiry had underpinning guidance, underpinning engagement work and evidence work that fed into the development of these 9 lines of inquiry. And there was plenty of stakeholder engagement with members of the public, with professionals, and we were testing our assumptions, refining our thinking as we went along. So this was very much in co-production that we have worked on as part of the discovery phase. And underpinning that, at the heart of all of this, of course, is the Professional Standards Authority's occupational risk model, which is the right touch regulation principles. And that is about identifying the optimum or the proportionate level of regulation, so proportionate to the risk that you're trying to manage. So if we are looking at a high level of risk, then the interventions, the regulatory interventions that we identify would also have to be similar in nature. So all that has been part of phase one. Also part of that initial thinking has been these key working principles. So as part of our methodology at NMC, for any work that we undertake, whether it's a standards related work or any policy work, we do identify working principles that serve as a guiding framework really for this piece of work. So at the heart of everything that we do, of course, is public protection and enhancing public confidence. So we know that that is the ultimate aim of everything that we do, including this particular review. We also wanted to make sure that we uphold the NMC values of being fair, kind, ambitious, and person-centered as a regulator. We also wanted to make sure that all of the principles or all of the options that we identify and develop are aligned to the right touch regulation principles that I mentioned earlier. More importantly, we wanted to make sure that any approach that we develop is suitable for both nursing and midwifery professions on our register, and it can be applied across the 4 countries of UK. We also wanted to make sure that the principles of co-production are firmly embedded in it so that we can use robust evidence when we develop our regulatory options. And at the same time, making sure that equity, diversity, equality, and inclusion are part and parcel of everything that we do. We also wanted to make sure that the options development work is not just about the here and the now, but it's about how things will be in the future, what the requirements of the public will be in the future. So we wanted to be that much more ambitious and future-proofed. So I've mentioned the regulatory options. So just a reminder for some of you who may not have been part of this journey, the 6 key regulatory options that we identified have been starting with maintaining status quo, which is basically not doing anything at the moment. What we have is basically status quo. The second, what we have is developing some kind of joint statement or set of principles, which would be very much in the collaborative space. So they're not really mandatory, and they would be sitting across different professionals potentially, but something that would apply across the 4 countries of UK. The third option that we have on the table that we looked at was credentialing. Now, that's not something that we have done in the past. We're looking to lessons that we can learn from other regulators and what are the cost consequences and what's the level of assurance, more importantly, that we can get from this particular option. Fourth potential option on the table was revalidation. Now, what that would involve really, revalidation is something that all those on our register are required to provide assurance to us on. However, what we're really looking at as part of the regulatory options here are those additional requirements that we might set for those, or tailored requirements, I must add, for those individuals who work in advanced practice roles. The fourth option that we had, the fifth option that we had was test of competence and looking at meaningfully, can there be a test of competence for anyone who wants to call themselves an advanced practitioner? The outcome of that test and all of that, of course, hinges on the fact that we would have some kind of level of expectations or standards. So in reality, it's quite interlinked to the last option, which is setting education standards. Now, within that, the setting standards option as well, we're looking at setting proficiency standards or capability standards. And alongside that, underpinning those would be your program standards or education standards for those education providers who are running programs to help individuals to call themselves advanced practitioners. So these were the different regulatory options that we considered, and each of these were considered in detail in terms of the cost and the consequences attached to them. More importantly, what are the risks and the benefits that we can derive from each of these? So this slide really just sets out the process that was used to identify the regulatory options. So as I mentioned earlier, we had 9 key lines of inquiry that were identified to break down this big topic of advanced practice and the regulation of advanced practice. And that fed into the development of regulatory options and the appraisal of those options, more importantly. Now, closely linked to the appraisal of these different options is the economic evaluation Now, that is something that we added on slightly later. So we commissioned an external agency to conduct a cost consequence analysis for us. That work has shaped a large part of our regulatory options development. And you will see some details of that in our council paper, which is published on the website. The other little box you'll see is looking at the impact on internationally educated nurses and midwives. That is something that we added on slightly later in our journey because we realized that that is a big chunk of the individuals joining our register. And really, as I mentioned earlier, it's going to be about the future rather than the here and the now. So we need to look at what are the potential impacts on this big group of individuals joining our register. Equally, what is the value that they bring when they when they join our register. So that is something we are considering as part of our 9 key lines of inquiry. In addition to that, we also commissioned 2 independent pieces of research. As I mentioned, the Nuffield Trust report was quite important for us. Underpinning all of our key lines of inquiry were also numerous pieces of literature reviews that we conducted, both in-house with our research and evidence team, but also externally. And these have really helped shape the evidence base that has helped us identify these regulatory options. More importantly, the third and quite important strand of this whole evidence gathering exercise has been stakeholder engagement. And we have done an extensive amount of stakeholder engagement in this time period that we had. And in fact, what we did was we conducted an independent thematic analysis of the themes that were coming from all of the different kinds of stakeholder engagement. We have an excellent team of nursing and midwifery advisors for advanced practice across the 4 countries of UK, and they've really helped us to reach out to both members of the public and professionals within their countries. And we've got a strong policy and standards specialist team as well supporting all of this piece of work. So a quick reminder of what those 9 key lines of inquiry were. So the first 2 were looking at a comparative analysis of current advanced practice frameworks as they exist within the UK. So that includes looking at whether there's some of them are nursing or midwifery, or whether they include nursing, midwifery, and allied health professionals, and what are the areas of commonality and differences across all of these. Now, the second one, which is quite closely linked to that, is looking at advanced practice models that exist globally, other countries that have got well-established advanced practice regulation, just identifying what are the lessons that we can learn from them. Are there any elements that we can bring to our own development? So that is something that we have tried to consider. We do recognize the context is different, of course, but if there are things that we can bring in, what is it that we can learn from all of those models? The third and fourth quite closely linked key lines of inquiry have been looking at scope and level of practice considerations, because as I mentioned, advanced practice is very much around a higher level of practice that we are looking at. And you could have advanced practitioners regardless of their professional background. So we're trying to look at what are the implications for additional regulation for these particular group of professionals. Then fourth is about task shifting and looking at really what happens to scope of practice when you've got tasks that were initially performed by other professionals being now performed by nursing and midwifery professionals. And again, what are the implications from person-centered care and, more importantly, from a regulatory perspective. The fifth one was supervision, assessment, and continuing professional development, or CPD. And I must clarify here that within this particular key line of inquiry, we not only looked at those trainee advanced practitioners, so those who are seeking to become advanced practitioners, but also those who are practicing currently as advanced practitioners and what kind of clinical supervision support they currently have. Sixth one was looking at other professional regulators within the UK. So we have a joint regulatory group that meets quite regularly, and we are trying to compare and contrast, again, what kind of lessons we can learn, and more importantly, what is the scope for collaborative working with other regulators across the UK. The seventh one, which I mentioned in the previous slide, was about economic cost benefit, or cost consequence, as it's called, to identify what are the implications for all of the regulatory options. And then looking at risks and benefits that are associated was covered in key line 8. And then ninth one, which we added lately, was about the impact on internationally educated nurses and midwives. I'm now going to hand over to Paula, because as I mentioned, stakeholder engagement has been a really valuable and key part of this particular phase of the project. So we're going to go into a little more detail in terms of what we've heard from stakeholders. So over to you now, Paula.
Thanks, Aditi. So I'm going to talk, as Aditi said, about the stakeholder engagement that we undertook, which was quite extensive across both public and professional groups. So we wanted to be sure that the public and people were at the heart of the review, recognizing our role as a role in public protection. So in order to ensure that we did that, we established an advanced practice public advisory group, which consisted of members of the public, but also those representatives from advocacy and charity groups. And they were really key in kind of sense testing and developing our work. They helped us to develop the public survey, so they made sure that we asked the right questions and got the wording right. They also fed directly into our independent steering group. We had our nursing and midwifery advisors held roundtables and meetings with members of the public and people who use services from across the 4 countries of the UK. So recognising that there are different frameworks in place, as Aditi mentioned, in each of the country, and the slight nuances in how healthcare is delivered and how advanced practitioners work. We undertook a survey of 2,000 members of the public around their experiences of advanced practitioners. We had a separate roundtable with maternity service users, which was really helpful in developing our understanding around their experience of advanced midwifery practitioners. And we also engaged with our own Nursing Midwifery Council Public Voice Forum. And this group was key as well, because they are members of the public, but they have an understanding, or more understanding than most people, about our regulatory role and responsibilities. So, as I said, we undertook extensive stakeholder engagement. So in total, we engaged with around about 4,000 individuals through various round tables, etc. We asked for feedback on the approaches that we used. On the whole, we had a really positive feedback about the level of interaction and engagement. And Aditi also mentioned our joint health and care professional regulators group, which consisted of all the professional regulators from across the UK involved in that group. And again, that group fed directly into our independent steering group. So this is just a bit of a bit more of a breakdown of our stakeholder engagement. And again, the detail behind this is in our council paper, which you can see on our website. One thing just to note on this slide is our advisor updates. So although that wasn't included directly in the numbers, our advisors did engage widely across their own countries within their own networks, and it was really helpful in ensuring that people felt up to date with the progress throughout phase 1. So we undertook, and Aditi mentioned this, an independent analysis, a thematic analysis of all the engagement across all of the groups that we engaged with. And none of this is probably a surprise to anyone. There was widespread positive recognition of the advanced practitioner's role and its importance within the health and care system, for all the reasons that you can see there, in terms of improved quality of care, supporting career progression for professionals themselves, which aids retention, and also thinking about the workforce plans. And you'll know that across the 4 countries, advanced practitioner numbers are part of those workforce plans, and there are plans to grow that workforce significantly. There were concerns around variability and inconsistency in the AP role. This helped to build on the evidence that the Nuffield Trust report identified, and we continued to hear about that across the sector and across education and training, qualifications, roles, responsibilities, and governance. There was also concern around lack of standardization of the role and ongoing assurance of competence and capability, and that came through loud and clear across both professional and members of the public stakeholders. So there was consensus across all groups of the risks to public protection of maintaining the status quo. It was felt that additional regulation was an opportunity to reduce the variability and inconsistency seen, a real opportunity to increase the public's understanding of the role and therefore strengthen confidence and trust in our nursing and midwifery professionals and provide clarity, importantly, across the sector. As the largest professional regulator, we were seen as having an ideal position in being able, an ideal role in being able to take on additional regulation in terms of mitigating those risks from the variability. Also importantly, professionals felt that or additional regulation would help them to feel supported. There'd be clarity around their role, so there'd be more clarity around the requirements for developing and delivering the AP role. And the members of the public in the capabilities and competencies of advanced practitioners and their expectations around what they could deliver. Most were in favour of objective, measurable approaches, and what became clear as well was that no single approach was deemed to be able to mitigate all of the risks. So our independent steering group reviewed all of this evidence, so our options appraisal, our independent analysis, and we made some recommendations to our council, and our council agreed at the end of March to proceed to additional regulation of advanced practice for both nursing and midwifery professionals, and approval to proceed to phase 2 of the review, which is where we're at now. So in developing that additional regulation, our council agreed to developing standards of proficiency, and those standards of proficiency detail what an advanced practitioner should be able to do once they've undertaken an approved education program. So we'll be developing those standards of proficiency as well as the associated education program standards. Adopting a collaborative approach, so the development of a UK-wide framework which brings together all of the frameworks that are currently in existence. So that's a big piece of work which will bring together not only the other professional regulators, but systems regulators, as well as those who've been involved in the development of those frameworks which are in existence. And ensuring that advanced practice requirements are included in the wider review of revalidation and the code, which is already scheduled for 2025-26. I am going to hand back over to Aditi, who's going to give a little bit more detail about those recommendations in terms of how we've formulated some work streams. And again, I'll just remind colleagues that this is the beginning of phase 2. We haven't started this work. We will be engaging with you as we develop standards, as we develop approaches and processes. One thing I didn't talk about on the previous slide, which is to developing a process for existing advanced practitioners or those who are currently in training, so that you'll be supported to meet any additional requirements. It's known as grandparenting, and some of you will be familiar with that term, and we're happy to talk about that in a bit more detail, but it is one of our key work streams. Thanks, Aditi.
Thanks, Paula. Your connection did go a little bit funny in between, but hopefully we picked up most of it. But if anything's not clear, please use the Q&A option. I'd just like to remind people of that. So as Paula mentioned, this is just our initial thinking in terms of phase 2 work streams. This is all subject to all of that being undergoing all of our governance sort of processes. We are taking all of this to our exec board this month, and all being well, we hope that we can start work on this properly from next month. So the first work stream that we've identified, which of course is drafting the standards of proficiency for advanced practitioners, and that includes looking at both nursing and midwifery advanced practitioners. And we will conduct a public consultation where we will be able to share those draft standards of proficiency with yourselves, and you get feedback on that. Now, closely linked to the standards of proficiency, of course, is going to be program standards or education standards. And again, we will publicly consult on these. But I also want to remind you that this will have an element of quality assurance and implementation. And more importantly, you should also note that the methodology that we have at NMC is very much of co-production. So you will have opportunities to shape our thinking as we go along. So the public, even before we publicly consult, there will be opportunities to help us actually draft these standards of proficiency as we go along. The third framework, which aligns to one of the regulatory options of joint approaches, is to look at a possibility of developing a unified UK-wide advanced practice framework that sits across both nursing and midwifery. We are speaking with other healthcare regulators as well and systems regulators, and ideally we'll try to get everyone along to help sign up to this unified framework. The fourth option, and quite importantly, is looking at existing advanced practice professionals. So those who are already working as advanced practitioners or those who are training to become advanced practitioners, what we call in regulatory terms as grandparenting. So we're trying to look at how do we realistically transition all of that very valuable chunk of our register or professionals who are working in those roles so that they can transition on to or map to whatever new regulatory requirements we will be setting. So that's another key piece of work stream that we will have. And then last but not the least is looking at how we could embed advanced practice considerations in a planned review of revalidation and the code. Now, we are looking at reviewing our code and revalidation sometime in the next year or after. And at that point in time, we will look to include additional or tailored expectations around advanced practitioners. So that is slightly staggered. The first thing that, of course, we will start with is the top four ones, which I mentioned. Again, just want to stress on the fact that this is very early days. We will begin work on this in May. So I would say watch this space. And more importantly, how you can continue to stay in touch with all of that is by joining our community of interest. Everything that we've mentioned today is part of the website updates. All of the reports that we've mentioned have also been published on our website. So do have a look at all of that. And then through our work streams, we will reach out to specific stakeholders so that we have more targeted engagements and we can get valuable expertise and inputs for shaping all of our proposals. And we will engage with 4Country through our networks, through our advisory colleagues, and you can help shape all of our thinking. So keep an eye out on our newsletters and emails and do stay in touch. Now, I'm going to stop talking because I know many of you will have lots of questions. So I'm going to bring in two of my colleagues who can help us with the chat box and things that have been coming in. So welcome, Claire. Please introduce yourself and you can tell us the first question as well. Here comes Sinead.
So, well, I'm Claire Sutherland. I'm the nursing advisor for England, and I'll hand over to Sinead.
Hi, everyone. I'm Sinead O'Kane. I'm the midwifery advisor for Northern Ireland. And I'm going to start off with the questions. So I've grouped a couple together. So the first one was, I'm an AHP rather than a nurse, and we are regulated by the HCPC. Have any of the other regulators shown an interest in following your recommendations? I've heard in the grapevine that the HCPC have no current intention of regulating advanced practice because there's no evidence that this is unsafe. Is this true? And another question, but it's similar vein, advanced practitioners come from a range of healthcare backgrounds and work in multi-professional teams. How are other regulatory bodies engaging with the NMC's work here?
Great. I'll kick off. So just to say, as we've discussed throughout, we have had the 9 other professional regulators who have been collaborating with us throughout phase 1. We will continue to collaborate with them, particularly the HCPC. We recognise that individuals, we all work in multi-professional teams across the sector, But it's also important to recognise that all roles are regulated. Our focus is on nursing and midwifery professionals, but where possible, we would continue to work with and align with the other professional regulators, particularly the HCPC. I don't know what their plans are. The question recognises that in 2021, their review was felt to did not identify any risk to public protection that required additional regulation. We're in 2024 now, and our review has identified risks to public protection. So we will be proceeding with additional regulation. The HCPC and the other regulators will also be involved in that work stream around the unified UK-wide framework. And I think that will bring consistency across the sector because that will create clarity for employers, etc., to understand the requirements of the roles across the 4 countries. So hopefully I've answered all that, Sinead.
Lovely. Next question. Good question. Will the NMC consider the audit / regulation, we'll say about regulation of universities providing ACP courses to ensure the current award gap for BAME students is reduced and students are successful in entering the workforce? Then there's a second part. Will the NMC also consider regulation of qualified staff who are teaching on advanced practice courses in universities with current clinical practice? So 2 slightly different. The first part about the BAME students.
Yeah, so you'll know that throughout the work that we've been doing around our other education standards of proficiency, and I can't imagine that any education standards for advanced practice would be any different. There are requirements where AEIs or approved education institutions have to provide evidence of how they're addressing any kind of shortfall in their the diversity of their student populations. So through our kind of quality assurance processes, every year universities are required to provide that information for us. We're also trying to develop a better understanding of the needs of internationally educated nurses and midwives, so who are coming to this country with advanced practice qualifications already, or who may be wanting to pursue a career in advanced practice, and trying to understand some of the kind of enablers and barriers to that. And I think that will help to feed into our to the development of our education standards. The second question was around those working in AEIs, the education sector, who are teaching on advanced practice programs. So you'll know that everyone is aware of the 4 pillars of advanced practice. So nobody, through our grandparenting process, will make sure that there's an opportunity for everyone who considers that they're working in an advanced practice role to be able to be supported to meet those requirements. So those individuals will have to meet the requirements of the standards of proficiency. We envisage that there will be an annotation on the register for those individuals who do meet those requirements, whether that's through an approved education program in the future or through the grandparenting process that we talked about today. That's all still in development. So, colleagues on the call have an opportunity to help shape that through the work streams and the engagement. Does that answer the question, Claire?
Yeah, I think the teaching was, as I read it, was slightly angled towards are those that are teaching advanced practice, how are we going to ensure that they are safe and effective educators rather than being advanced practitioners? That's how I sort of interpret it. But yeah. Thank you.
And it will be part of the discussions and conversations to make sure that we do include that and we do think about that.
Yeah.
Okay, so another question. You continue to talk about advanced practice about one role. This doesn't reflect practice. The roles undertaken can be specialist roles or more generalized practitioners, such as already defined in the ACP role. Has this been incorporated into your analysis?
Absolutely, it has been incorporated, and that's why going forward we talked about scope of practice. We're very much focused on a level of practice. So we recognize that there are a number of different roles: clinical specialist, nursing and midwifery roles, consultant nurses and midwives. Now, with us focusing on a level of practice, some of those individuals who are in those specialist roles may meet that advanced level of practice and some may not. So whatever process is developed, it will be focused on the advanced level of practice rather than on specific roles.
Thank you. Next question. I'm going to just do this because there's quite a few around grandparenting, as there was in the previous webinar. So I'd be interested in the grandparenting requirements, as we've quite a few ACPs that are anxious around any additional work or evidence collation that may be required. Thank you.
So I can't tell you the requirements because we haven't developed any processes yet. So we haven't done grandparenting before. So part of that work stream will be having those conversations and really understanding what those requirements might look like. So as I said at the beginning, this is not going to happen overnight. This is going to take time to develop those approaches. We are just in the process of talking to our executive board about our timelines. As soon as we have clarity on our timelines moving forward, we will share that information on our website. But this is going to take anywhere from kind of 3 to 5 years to be able to kind of get these things developed, consult on them, and then implement them in practice. So it isn't going to happen overnight. We don't have any requirements developed yet. So hopefully that helps.
Thank you.
Thanks. So, as Claire said, there's a few questions in there in relation to grandparenting. One of the other themes that's coming forward is surely the multi-professional framework definition of APs, which is widely recognised and used as something that can be used going forward. Ditto the standards and capability framework that has already been published. How will it be reconciled at the different roles and settings that the AP work in?
Yeah, so it's important to remember that those frameworks are England only, and we're a 4-country, regulator. So every country, as Aditi mentioned within the presentation, has a slightly different framework. Some are not multi-professional. So that work stream, again, will bring all of those people together to have those conversations. Okay, we're going to have a unified UK-wide advanced practice framework. What can we learn from what England's done? What can we learn from Scotland's framework, from Wales' framework? And how do we develop something which is robust for the 4 countries?
Fabulous. Question around, will the proficiency standards consider the complexities of the bespoke requirements of the speciality the AP is working within?
So Aditi might want to take this one.
Yeah, sure. I mean, there's a lot of lessons to be learned from our previous work with our post-read standards, because there you have got different fields and, you could have plenty of different specialisms. But you have to remember that the standards that we set will be regulatory standards. So it's very much going to be the level of practice that we're looking at rather than looking at specialism. So we don't want to get into the specialist or generalist debate at all, because really, from a regulatory perspective, what we are trying to look at is what members of the public can expect from those who are working at this level of practice, regardless of their background, regardless of their specialism, regardless of where they work. So that could be any sector, anywhere in the UK, really. So they are going to be high-level outcome-focused standards rather than looking at any detailed curriculum or detailed proficiencies. So yeah, hopefully that answers the question. Paula, do you want to add anything to that?
No, I think that's right. I think if you focus on on the level of practice rather than speciality, and it will be down to AEIs to decide how they're going to meet our standards, and that may, there are a number of different models and approaches already in place across the UK. But they'll need to demonstrate how their programs, taking into account those nuances, meet our standards.
Thank you.
It's also I'm just going to say, Sinead, I've just come
Yep.
across a question here, and it's about how does this compare and complement the recent NHS Advancing Practice accreditation? This is a huge amount of work, and that links into another, what sounds like an HEI query about what degree of input does NMC envisage HEIs having on drafting of programme standards, and what's the timeline for their involvement? Does the NMC acknowledge the massive amount of duplication this will demand on HEIs and individuals who've already been through this accreditation process? So it sounds like anxiety around or acknowledgement about the amount of work that people have already gone through.
Yeah, so on we've obviously been engaging really closely and updating on progress with the Council of Deans of Health. So we're acutely aware, and we said throughout the presentation, you know, and what came through in our engagement was not being overburdensome and recognising some of the work that's already been done. So we're really clear that we want to continue to recognise that work and use that work. But we have to remember that our role is in public protection, and we have to recognise the very real risk that's been identified through phase one and through earlier pieces of work. I can't remember the first part of the question was for individuals, so that was for education institutions. So absolutely, where possible, you will still need to demonstrate that you meet our standards. You still will need to go through an approval process. How that looks, we don't know yet. You will have an opportunity to kind of be involved in engagement, and will also publicly consult as well, but there'll be lots of opportunity for conversations with HEIs.
Thank you.
The individual question around kind of the processes, again, it's the same principle, you know, where possible, we don't want to be overburdensome, but we want to recognise that the right people are on the register and providing care, because we recognise there's a risk. We haven't, I know one of the questions from the last webinar was around digital badges. You know, we won't be taking over digital badges. It's not something that we get involved in. But we will be working with colleagues from the Centre for Advancing Practice, as I say, and the other country organisations, the RCN, on the frameworks that are already in place.
Thank you, Paula, and I'm glad you brought up digital badging, because there's been a few questions there, just like earlier today. Another question that's come in is, I acknowledge the risk you identify about patient safety. Should the NHSE advancing accreditation be put on hold?
I can't answer that question. I think what I would say is I would go back to what I said earlier, is that this is not going to happen overnight. So all of those processes which are currently in place will continue, and employers and individuals will need to have those discussions themselves as to how they proceed. But introducing education standards, introducing a process for grandparenting, as I said, is going to take 3 to 5 years.
I've got a question here, Aditi, well, either of you. Will the advanced practice standards provide parity with the community specialist practice roles, including SCIFN and SPQ, as these were updated by the NMC in 2022?
Well, that's one for Aditi.
Yeah, I mean, well, as I mentioned right at the start of this presentation, those post-read standards have always been a bridge to advanced practice. So we are absolutely going to try and see how best we can map those to whatever proficiencies that we develop. In fact, those are pretty much our starting point for proficiency development, is what I would say. The other thing to watch out for is regulatory reform, and what changes come about as a result of that, and how our register looks like as a result of any changes that are brought forward. So those are all things that we are going to consider. So looking at when we say we recognize advanced practice, what does that actually mean? That is something we're trying to bottom out. And again, these are more in the question space. We haven't really identified clear-cut answers to those. We want to work with stakeholders, in fact, to identify the right kind of questions, and of course, then try and answer them. And on that note, actually, I am going to respond to another question that I can see in terms of engaging with trusts and employers. So yes, absolutely, we are going to do that, because as part of our stakeholder groups, we did engage with employers as part of phase 1 as well. And we will continue to do that. We will continue to engage with trusts and employers. And we'll try and engage with employers outside of NHS as well, because we recognize that advanced practitioners work in a range of different settings. So we've got social care as well. So just recognizing that advanced practitioners could be working in lots of different areas. And we regulate everyone on our register, regardless of where they work. So we will be engaging with members of the public, with employers, current education stakeholders, current practitioners, but also those who are aspiring to be advanced practitioners as well. We will reach out to them. So keep in touch with us is what I would say.
There's one. Go on, Sinead.
Go ahead, Claire. Go on, Claire. You're fine.
I've just seen this about another work stream that I thought was quite useful.
Yeah.
Many thanks, very helpful. You've mentioned that a work stream will be the impact of advanced practice regulation on internationally trained nurses. Will this work extend to advanced practice practitioners currently working in the UK as APs but received their training education in another country where AP was regulated previously?
So yeah, so it's a key line of inquiry at the moment. It may well, I envisage it's going to turn into another piece of work. It's kind of evidence gathering at the moment. So yes, absolutely, we'll be looking at internationally educated nurses and midwives, those who are working in advanced practice roles in their own countries, what that means and what that looks like, whether qualifications recognized, etc. And equally for those nurses and midwives who've joined our register but want to pursue advanced practice and are maybe not getting those opportunities. So this is the evidence gathering piece of work that we're doing at the moment. But as I say, I think that will result in wider work, not only for advanced practice, but potentially in other areas as well.
And on that note, actually, I'd like to add to Paula's point that we, for that particular key line of inquiry, we've commissioned a piece of work, and there will be a survey that we are going to be running soon. So keep an eye on our website where we will be running a survey specifically for those professionals who are on our register who were educated outside of UK and who went on to join our register. So it's not just for advanced practitioners, as I said, but anyone who wants to be an advanced practitioner will also be able to participate in that survey, because we want to identify, as some of you have mentioned, actually, what are the enablers and barriers, because we recognize that access is an issue and that there is an equality, diversity, access issue as well. So all of this will form a part of our thinking to make sure that there is equitable access for anyone who wants to be an advanced practitioner.
Thanks, Aditi. And there's a couple of colleagues have raised, is there going to be additional cost to being regulated as an advanced nurse practitioner?
So,
Or midwife.
Or midwife. So that will be part of our discussions and our thinking. My understanding, and Aditi, you can correct me if I'm wrong, is that the registration fee hasn't increased for the past at least 10 years. So that's something that's already being looked at as part of regulatory reform on a wider scale, not just around advanced practice. But these are the implications and the things that we need to take into account in any of the work that we do. So we don't know yet, is the answer. But what we did hear through engagement was that the people that we spoke to wouldn't be averse to an increase in their registration fee for the additional benefit.
There's a pile of other questions, but we're at 4 o'clock. So I think we were going to collate answers and or questions and try and answer off this webinar. Is that right?
Yeah, that's right. There's always loads and loads of questions, but I do just and I know there's a lot of kind of potentially anxiety about what this all means, but it is a journey. This is the start of phase 2. just like at phase 1, there was a lot of anxiety. What are you doing? Why are you doing this? We will be engaging with you. We want to hear from you. We want to understand what's important to you. What are the challenges? It's a complex area of work, and we recognize that. So do please continue to engage with us. Hopefully this afternoon has been useful. We will put an update on the website with the Q&As, with the questions that we haven't been able to answer. If there's anything else, you can email us and we'll get back to you. But really, thank you for your time this afternoon, and thank you for your interest in this work. And we look forward to meeting you next time.
Thank you very much, everyone.